Hey there, it's Dr. Brian McKay, not just a chiropractor for Stamford, Darien, Norwalk, New Canaan. And once again, I apologize about the long, lengthy name, but I'm sure you understand. Well, anyhow, emergency chiropractic care. Yes, this is a little self-serving because I am a chiropractor, as you know if you listen to any of my other podcasts. What I want to talk to you today about is you got a bad back pain, middle of the night. What are you going to do? You go to the emergency room. Chances are you're going to get there. You have to fill out some forms. You're going to be waiting. There's a lot of other sick people there. And you wait and you wait. Finally, they get you in. The resident comes in, says, okay, we're going to go for x-rays. You go get the x-rays done. You go back, you wait. They come out with the x-rays. They say, okay, I'm going to send you to an orthopedic. I want you to take these pills and take a week off from work. Well, sometimes that doesn't always work. When it does, great. Problem solved. We at Core Health offer emergency chiropractic care on weekends. Now, listen, you call me at 2 o'clock in the morning, chance I'm going to tell you I'll see you at 7 the following morning. But you have to understand, you come to see a chiropractor who can handle an emergency case, you're going to leave not only with x-rays, you're not going to be kept waiting. It's actually, a lot of times people have to pay the deductible when they go to the emergency room because so many people would abuse that right and they would go and, have nothing to pay. So it's almost sometimes cheaper to go see a chiropractor on an emergency basis. At least you should get x-rayed, you should get some form of treatment, you should get some recommendations, and at least you'll be a little bit more comfortable, hopefully, rather than sitting in a crowded waiting room full of sick people. Yes, so emergency chiropractic does exist. It's a matter of who's going to take the case or not. I live in the same town I practice in, and we also serve Stamford, Norwalk, and New Canaan, hence the lengthy name of this podcast. But what happens there is someone can text me on a Sunday morning, Sunday night. A lot of times I get these. The father of the bride is in agony at the rehearsal dinner. You got the wedding the next day or two, and what are you going to do? Well, who's got the time to go to the emergency room again? Who wants to go to the emergency room? This is where sick people go. A back pain doesn't necessarily mean you're sick. It's just an idea. Oh well, if pain's that bad, I'm going to go to see the emergency room doctor who's really not equipped other than to get order the X-ray taken, wait, wait for the radiologist to read it, and then come in and say, "Well, I'm going to give you this. Take this, this, and the other thing. Here's his muscle relaxer. Here's his painkiller. Be on your way." So it's a little bit. You're almost going to the wrong place. It's like going if you need a tooth filled, you don't go to a dermatologist. You got a bad back pain. Yeah, you go to the ER, but they're not going to touch you. They're going to take a look, do the X-rays, again, make you wait. You could be in the ER 3-4 hours, and that's maybe on a good night. You take a bit, say Fourth of July weekend or Christmas Eve. I mean, I actually remember coming in on Christmas Eve, and you know what? Sometimes you got to do it, but in an hour or so of my time versus you getting the care you need quicker. So emergency chiropractic care does exist. If you have a relationship with your chiropractor, find out if they will honor that. Maybe they'll make accommodations, give you a cell phone number because it's really about helping people. Chiropractors love to help people, and medical doctors do too. It's just that for a mechanical issue, and most back pain issues are mechanical in nature, that you could take a muscle relaxant, but that's not gonna that may take it down a little bit, or an anti-inflammatory. But anytime you have pain, you have inflammation. So just by decreasing inflammation a little bit doesn't mean you're going to get that much relief in terms of pain relief. But again, anytime there's pain, there's always inflammation. They go hand in hand. You cannot feel inflammation. Just like you say you have heart tissue that's inflamed or chronically inflamed. You can't feel it till you have a heart attack. Well, again, pain and inflammation are two, they go hand in hand. You have one, you're going to have the other. Although, I'm sorry, I stand corrected. If you have pain, you definitely have inflammation. If you have inflammation, you don't always have pain. So, coming to see a chiropractor can make a lot of sense and save you a lot of misery. And it's a service you offer because we really enjoy taking care of our patients. Now, today is Good Friday. I hope you're having a great Good Friday. I'm Dr. Brian McKay, not just a chiropractor. And emergency chiropractic care is welcome. Again, If I'm awake at 2 o'clock in the morning, I probably will take the text and tell you I'll see you the following day. But it's one of the services we provide here at Core Health. Um, have a good Friday. Have a great Easter. Dr. Brian McKay, not just a chiropractor, Stamford, Darien, Norwalk, New Canaan. Got a question? 203 656 3636. 203 656 3636. Happy to help. Have a great day.